Got my hair cut. Hello, everyone. I'm François Picard. Welcome to the France 24 debate here in France. It's day one of deconfinement. That means 70,000 hairdressers' salons have reopened. Day one of deconfinement means we're going to be asking how the first rush hour went since the beginning of lockdown on March the 17th, the first day of school for a select number of grades, the first day on the job for many businesses, large and small, and whether the easing of confinement could prove short-lived. There are new outbreaks in this country and in neighboring Germany, where the easing of lockdown began sooner, to borrow Chancellor Angela Merkel's line, when to pull on the emergency brake. You can ask the same in the UK, where England seems headed perhaps for different rules than Scotland, Northern Ireland, and Wales. It's crisis management on an unprecedented scale. And to look at the future, well, we need to examine the response so far. When is the right time for a reckoning on the French government's policy regarding face masks, testing, contact tracing to prevent future outbreaks and contain them, and the messaging to guarantee that vital ingredient to get through this, public trust? Today in the France 24 debate, we're looking at how to ease lockdown. And joining us from France's second city, Lyon, Dr. Jean-Louis Touraine. He's a professor of medicine and member of parliament for Emmanuel Macron's La République En Marche party. Thanks for being with us.
Thank you.
We also want to welcome from the Normandy capital, Rouen, Municipal Councillor Laura Slimani of the Génération S party. Welcome to the show.
Thank you.
And here in the French capital, a German entrepreneur and political commentator, Jakob Hessler, is with us. How are you?
Hi, how are you?
I'm fine. Thank you very much. The France 24 debate, where you can join the conversation on Facebook and Twitter. The hashtag is F24debate. Yeah, I got this here from a kindly people from my local municipality. I live in the suburbs, and we can take a look, and it's 2 face masks, which everybody got the day before. And what's your assessment, Jean-Louis Touraine? There was a lot of coverage this morning, how the first trains at rush hour was difficult to enforce any kind of social distancing. Tell us what it's been like where you are in Lyon.
In the public transportation, virtually everybody wore a mask. So it's a good news because for the past weeks, it has sometimes been difficult for some people to obtain these masks, but now most of them can be obtained in shops, in pharmacies, in various places. They are also delivered by the town halls. So this is one of the good news. The second good news is that the people were not too numerous in the underground or in the buses. So the physical distanciation was almost perfectly respected. It's never perfect, but I think this shows us that we are fully right in having public trust, because the people need to be actors of this new phenomenon. Nobody has all the answers. We, for instance, do not know if this is exactly the proper time to have this evolution.
Yeah, let's talk about that, if we will. I want to just quickly go around the room and just spell out for our international viewers what are the rules. First of all, Laura Slimani, you heard Jean-Louis Touraine there. There seems to be a contrast between cities around France and the capital itself. Is it the same in Rouen, where it's gone pretty well compared to Paris?
Well, honestly, I haven't left home yet. I will tonight, and I'm going to go to my parents and use the bike. So I think, yes, most people obviously are hearing the recommendations of the public authorities, and so they are respecting it as much as they can. But I mean, most people are wearing masks. It's true, and they are respecting the measures, but at the same time, I believe that these masks should be free, because if they are not, then there is a big chance that people at the end of the day are not protected in the right way or satisfactorily. They will reuse masks that they shouldn't reuse, or they won't be able to buy as many as possible, especially for large families who are also hit by poverty pretty hard. So I think, we probably haven't put in place enough of the guarantees to make sure that there is not a big second wave. But I'm confident that people will be as careful as possible.
Jakob
yes,
Hessler,
even though,
what's it been like? We'll get back to the issue of masks because it is one of the key components here for easing of confinement, for deconfinement, as we call it here in France. Jakob Hessler, what does Paris feel like?
Well, as a very responsible person, I didn't go out today. I had no need. So I worked from home, and I think that's what, to me, deconfinement is, so that those who have a need and a very strong desire can do so, but it doesn't mean that everyone should do so. It's part of as long as I don't need to, I won't. I will probably go out this afternoon, but for a specific reason. And I think that's precisely the trust in citizens, is that we don't now all flock like sheep outside just because we can, and we want to show everyone that we can. I think those who need to should go, and everyone should be smart and responsible about how he or she does it.
Yeah, just how much do you ease confinement? Let's take a look at what the rules are. Emerald Maxwell has that story.
Final preparations for this ice cream shop in Marseille. Like most of France, it's been closed since mid-March. Now it can finally reopen.
On est pressé que ça redémarre, que ça bouge, quoi, que tout le monde retrouve la vie, le sourire.
After 55 days in lockdown, non-essential businesses, from clothes stores to hairdressers, are reopening their doors across France. Markets and shopping malls smaller than 40,000 square meters can also start taking customers again. Many are happy about regaining some semblance of normality.
C'est un peu le début. On commence à voir une lumière un peu plus vive qu'il y a quelques jours.
Ressortir, voir des copains et boire des bières dans des parcs.
Parisians, though, will have to wait for that particular pleasure, as the capital and the northeast of the country have been designated red zones, meaning parks won't reopen until June at the earliest. Restaurants and bars will also remain shuttered across France, as will gyms and most beaches. Small cultural spaces and libraries may reopen, but large museums like the Louvre, theatres and cinemas can't raise the curtain for now. From Tuesday, though, children will begin to find a more normal routine, because it's back to school for kindergarten and primary school pupils, although attendance won't be compulsory.
Attendance won't be compulsory, and that's been one of the key issues. Earlier, France 24's Catherine Norris-Trent was in the central city of Blois. Here's what she had to say about the days ahead.
There's been an awful lot of people unhappy with the French government's plans to open schools on the 11th of May. A lot of people saying it's just too soon and that this is going to spread the COVID virus further and perhaps start a second wave around France. People worry too about the safety of their children. So it is voluntary for parents to put their children back into class. And I've spoken to some who say they're just not prepared to do that because of the health risk, perhaps of contracting coronavirus, because of reports of associated inflammatory conditions, which are said to be very rare, but still very concerning for parents, but also about the prospect that they could be spreading it to the wider family, and some of the conditions they're going to have to live through if they do go back to school. Let me take you briefly through those. There are going to be markings taped to the schools of all the floors of other schools, rather, showing the way that the children must walk around the building. They're not allowed to be playing any collective ball games. They're not allowed to be getting any books out of the libraries. They're being told not to share any of the objects in schools. They're being told to keep 1 metre apart. You can imagine how difficult that is going to be for some of the youngest children and for some of the teachers too. And the whole idea of schools here in France is, in the early years, based around learning to share and learning to live together. They're going to have to be seated at separate desks, all facing forward, not sitting in small groups. A lot of the activities that they used to do are going to be just completely out of the window. So some parents aren't happy about putting their children back into school, saying that it could perhaps be even more traumatizing for them.
What's your thoughts on that, Dr. Jean-Louis Touraine?
Well, I think that, of course, it's a bit risky. We know that because we do have experience of other epidemics, but not of this one. So we cannot exactly anticipate what will occur. And of course, we need to have an experimental approach and to be very prudent, very cautious. The word that Tony Fauci, the American expert, used to say frequently. He says, you don't make the timeline, the virus does. So the virus does the timeline. We cannot anticipate whether there will be here or in another place several new cases. Therefore, we must be very alert and do many tests and isolate cases as soon as they appear here or in another place. It can be in a school, it can be at the parliament again, it can be in various places. We must be cautious and ask to everyone to respect all the rules. But even with these rules, we know that there will be new cases of COVID-19.
Yeah, it's a tricky one when it comes to schools because there's only a month and a half left anyway in the school year. Working class families, they it's particularly difficult, Jean-Louis.
Families can choose. All families have the choice whether or not they will take their children to the school. So
but then when the teacher can't teach both online and in the classroom.
Exactly. So the children who prefer to remain at home and together with their parents, when the parents stay at home with work with tele work, as we say, in those cases, of course, the children can stay at home. But in other cases, the children, as you know, need to socialize, and they cannot stay forever in this situation. We know from the experience in the various countries that children are not prone to develop severe forms of the disease. There are very few cases, 1 or 2 dozens of cases of more serious cases in Europe, but it's very rare in children. Now, we also know that the children carry this virus less than adults, so that the children are not the main cause of dissemination of the virus. So for their own interest and for the sake of all the population, it's not a major danger to open schools. But of course, there will be a few cases. We must accept that. And it is also true for all the measures which develop today with the cities that are more open, shops and various activities. We know that, of course, the risk is a little more present.
Because COVID-19 is not the same according to what city or region you are in France. I want to touch on that with Laura Slimani, but first, just a quick word, Laura, about schools. There's no good answer, it seems. If you shut them, it's bad. If you keep them open,
There isn't, but I do believe that the government was very a bit reckless about opening schools, not in the fact that they decided to do so, but in the way this decision was made and in the lack of recommendations that schools got, or at least the cities, because the cities are in charge of the school yards and the school buildings in France. They had to build very strict protocols in order to guarantee the health and to guarantee that there's the least contamination as possible in the schools. And it does seem to me like the government decided to reopen them not for reasons regarding socialization of young children, which I can understand, but more regarding economic reasons. And this is why the government decided to reopen schools for the smallest kids, the youngest kids. Whereas, I mean, in spite of the fact that they are the least the least able to respect the social distanciation measures or wearing a mask or all of this, when you're from 2 to 6 years old, I mean, you can't expect kids to respect these. You can't expect them to be in classrooms where there's nothing they can touch, where they can't play with any objects. I mean, that's completely surreal. And this is why in my city in Rouen, We've decided not to open schools today or tomorrow. We are going to start reopening them on the 25th of May only, because this is the time that we need to prepare the schools, to prepare for the personnel to be there and to organize themselves within the schools. It's going to start with very small groups, and it's not going to involve kids in kindergarten, because it's just simply impossible to apply the health protocols, the health and safety protocols that the state sent. So, I think all along this crisis, we've seen a big disconnection between the state and the government and what's happening on the field. Unfortunately, some local authorities were there to sometimes fill this gap. But I mean, yes, I think there's a bit of recklessness in the way that this is done, unfortunately, and this also is the case for the masks and the testing.
And as you say, Laura, it's a lot a question of geography, of where you live. And let me ask you a little bit about Rouen, because you're an hour away by train ride from Paris. You're in the so-called green zone, where there are fewer cases of COVID-19. Now that commuters are going to be taking the train daily to the French capital, is that going to change?
It might, obviously. We have a very low contamination rate in Rouen. It's twice as less as the average in France. But I think a lot of people are still going to work from home. A lot of the workers who commute. I am one of them. Usually, I will stay working from home until June. So I hope that as many as employers as possible are respecting these recommendations when they can, obviously. And it's obviously going to have a bigger impact on the areas that haven't been contaminated that much so far. But one of the other weaknesses that I just wanted to touch upon is the testing, because it's acceptable to have new cases if we have a big if the organization of the testing is efficient. But the fact is that today we know we won't be able to do this 700,000 tests that the government said they would do every week to prevent the epidemic from growing too much and too fast. But we don't have today the means to do it. There's just been investigations, journalistic investigations about this. So it is a problem, because for deconfinement, but if we are exposing people more and not have all the conditions reunited to guarantee as maximum as possible everybody's health, I think it's not the way it should be done, and I think it probably could have waited for a week for us to be ready.
Jakob Hessler, why have there been 4 times more tests in Germany than in France?
Well, I think that's has to do, I think, and it joins the previous comments. I think the system of providing public health care in Germany has been more reactive. And I think so when you look in mid-June, they sequenced the virus and then put decentralized to laboratories the ability and said, please build your own test kit for the normal tests. And they all started building them. And
are those tests reliable?
No, these are the PCR tests. These are reliable. Yes, these are not the ones we talk about, tests from China that you get with the post-infection test. These are standard lab tests that actually also in France are very reliable, and many people can do, and many more people actually could do and could have done. My point is, I think there's a systemic error. There's a systemic problem in the way the testing was not set up, but then also in the same way, and it trickles down, how the health response was. I think France focused a lot on the public hospitals, which have done a heroic job of stemming the tide of cases, and they've been incredibly good at it. The problem probably is, and why there were so many more deaths, is because the ambulatory and general medicine support that countries like Austria and Germany were providing, which on the one hand allowed to treat people at home and test them at home, so they wouldn't come and put a danger the hospital and the part of the hospital that were not infected. But at the same time, you didn't wait until it was almost too late to get medical attention. The problem is with this thing like COVID, many people, your lung can only have a 50% capacity and you don't realize it. And if you only realize by the time you get to the hospital, it is much more difficult to resuscitate you than if it happens a bit earlier. And I think we always talk only about hospitals, but I think it's about the whole public health system outside of the hospitals that we really need to take a closer look for testing, for the masks, for the ambulatory and patient care of not severe or not so severe cases early on.
Jean-Louis Touraine, in 2003, France had this giant wake-up call. We had a big summer heat wave and a lot of elderly people died. We realized there was a lot of problems in our public health response and in our messaging. This time around, the lockdown lasted 55 days so far, the full lockdown. It's not completely over, as we've been saying. And yet we're still playing catch up, it seems, most notably on this issue of testing.
Yes, and actually, France is a very centralized, I would say, even too much centralized country. And it has been proven in this crisis that the central bureaucracy involves a delay in several solutions. And also it does not provide always the appropriate solution to places as different as, for instance, the full east of the country where there are many cases, and the west of the country where there are much less cases. So it has to be adjusted to the place. And the central bureaucracy, when from the beginning we were many asking to have tests available, we could not obtain them, although many laboratories were ready to develop this test. But the bureaucracy of our country tends to deliver authorizations and the capacities to do the test very slowly after some homologation and other agreements, which takes time. And all this demonstrate that it is not fully appropriate to rapid reaction, such as in case of a crisis. So,
is there a problem as well where it's unelected civil servants who have made big decisions, sometimes unbeknownst to the politicians who are elected? Most notably, we've looked at the case of the fact that you had before this huge national stockpile of face masks. That stockpile has dwindled over the past decade under governments of both the left and the right. And there was a big article about it in Le Monde over the weekend, Jean-Louis Touraine, where it seems as though what the politicians were saying was when the stockpile diminished, we didn't know.
Absolutely. This is something which we'd have to be corrected in the future. The decisions are not always developed in the fully democratic way by the...
If I'm to speak crudely, would it be safe to say that too many decisions are taken by so-called bean counters? You know, people who are just looking at the bottom line, civil servants who are out of touch.
It may be a little exaggerated to say that, but it's true that in too many cases, the elected people are informed lately of some decisions and are not, let's say, even in the ministers, there are people which are very well being trained and are very capable, who have been present for 30 years, and they have some decisions which have been taken long ago, and they continue to develop this despite new directives by newly elected people or ministers, and this result in the fact that what we see today are the results not only of the past years but of the past decades, and we need
And
to
there'll be a
correct that.
reckoning, you think? There's going to be a big rethink after all this is over?
Oh, yes. Oh, we certainly want to. We certainly want to. You may remember that WHO said that France was the country with the best health system in the year 2000. Today, it's no longer the case. And so we need to do the efforts to be again with all the capacity. It has been demonstrated that the people in the hospital, as it has been said, do a wonderful job, whether they are nurses or doctors or all of them. But the decisions, the administrative decisions, the bureaucratic decisions are not appropriate. And
Laura
this has to
what
be
would you
changed.
change?
Well, I mean, I think it's a bit, I can agree on some of this statement that has just been made, but I think it's a bit easy to push the responsibility back to the administration fully, because all of this is also the result of political decisions. And the first of one being the lack of investment in public hospital and public health in general. And I also agree with what was just said about the fact that health shouldn't just be based on hospitals, but on the whole system and how we make sure that it's involved in a general public health policy. So this is the first thing. The people who work in hospitals have been working there in dire conditions, in very difficult conditions for ages. There was a huge social movement in hospitals just before this crisis, which was also a testimony of the situation there, that was already lacking a lot of equipment and already having to make choices regarding people's health that were completely crazy for healthcarers to make. So this is the first thing. This is also a political debate of how much emphasis do we put on healthcare and on health in our policies, and how, and I think austerity measures also had an impact on the way our health system has evolved. So this is the first thing. But the second one is, the administration, it stems from a government and it stems from political decisions. At least this is what it should do. And one of the reasons I think why France is backwards regarding this and is facing all of these decisions that seem to come out of nowhere, and that ministers are not, aware of these massive, major decisions regarding destructing millions of masks before such an epidemic, for instance, is, we lack transparency, we lack accountability, we lack parliamentary control in France. We are a very a vertical presidential regime and system where basically the sovereign, the president is supposed to be right in everything. And I think that if this crisis should teach us something, it's that our system needs to be much more democratic, and for real democracy you need transparency on decisions, you need accountability, and obviously you need a much bigger sense of the importance and awareness of the huge impact that some catastrophes of different areas can have on our day-to-day life. I mean, I live in Rouen, and in September last year, we also faced a major industrial catastrophe, Lubrizol exploding, or at least this massive fire in Lubrizol. And we also witnessed the exact same thing, total absence of transparency, total absence of accountability, and people just trying to reassure the population and not telling them the truth. I think this is a big problem in the French system. And I probably don't know as much as the situation in Germany as my counterpart here, but I do believe that in Germany and in other parliamentary countries, there is much more trust in the public and much more trust in the parliament, and the parliament has much more ability to control the government. And this is a big democratic difference.
Yeah, I think that's your point. The important thing, though, is if we want to change it, we have to avoid getting into the party political underpinnings of it. If the parties involved in this will try to gain from the redesign, this will fail again. Because the problem is you have to do what's right, and you have to earnestly strive to do what's right. So, for example, on the public health side, yes, the hospitals were underfunded, but even if they had been more funded, the catastrophe would have still come almost the same, because the problem was that the originally nice designed top-down plan of creating a regional agency that coordinates patient pathways between your general practitioner, your ambulatory, and in ultima ratio, the hospital, this has never really worked. In the Grand Est, you had private clinics that were empty, while the public hospital were crumbling under the burdening because the ambulance dispatching system isn't used to sending sick people to clinics. Now this was addressed, but it was again 3, 4, 5 days. Or you had laboratories proposing tests to hospitals in the north of France, and they were being rebuffed because it wasn't in the habits. And I think the most important thing is it should be done in a non-partisan way, because otherwise people will try to profit from it and put political agenda items in it too much, and then it will.
But Jakob, let me ask you this. Can you do that in France, where we see, for instance, I don't know, you have, like, for instance, a left-wing Parents Teachers Association and a right-wing Parents Teachers Association. In this kind of country, can you have a non-partisan approach to public health?
I'm not even sure. I'm sorry. I'm not sure the question was addressed to me, but I'm just going to answer it quickly and then give you back the floor. But I think it's actually very healthy to have a political debate about this, because the question is, what kind of choices do we want for our civilization? And I think that this period of confinement has also led a lot of people to realize how, meaningless the system of constant consumption was compared to, preserving our health, for instance. So these are political debates, and they don't need to be driven by personal interest. But I think it's not healthy to say, oh, political parties are bad, because what we are seeing here is.
I'm not saying political parties are bad, and no, I think there should be struggle about political goals and objectives. But the question we're talking about, more democracy and more transparency, a different approach to bureaucracy, you need to have a consensus and not one party taking a pro or a con approach to the system design with just in mind its own clientele. And I know it's difficult for France, and it's probably not going to happen. I think it's part of the system that it is so difficult to have a debate. And it of course kicks in the prevention paradox. Look, Roselyne Bachelot was successful when she bought this.
A former health minister.
When she bought this vaccine for HNN1. Now, it wasn't needed, fortunately. Then, from her own party, people then had these big commissions that said it was a huge waste of money, which probably contributed to lowering the guard. Well, now she may have been proven right. But of course, if the prevention is successful, very often then some people say, well, it was all a waste of money. And I think the right mix between competence and citizens, I think we should have citizens engaged directly in this redesign and not just political parties. That's because otherwise
parliamentarians, it would be nice if parliamentarians would be part of it, because one of the problems in France is that parliamentarians have very little power on the government, and I think this is one of the problems. It doesn't, it also means implicating more citizens, but I think the parliament should really be reinforced after this crisis.
All right, just very briefly, because we're running short on time. We've talked about the public health response to this crisis in France. We should also talk a little bit about the economic response. A lot of shops, small businesses, reopening for the first time since March the 17th. Earlier, we asked how day one was going to Brian Spence. He owns the Abbey bookstore that's in the heart of the Latin Quarter between Notre Dame Cathedral and the Sorbonne University.
We've actually had about 7 people in, mostly to pick up books that they ordered from before confinement. And even though we'd stayed open a few days to help people get their books, a few couldn't make it then. So they were here this morning and picked up those books. And we've had a few little kids in to go to the kids section. And there was enough time for me to put up my plexiglass protection by the cash desk. And it's a dark and stormy day, though, so I think it's a good day for people to stay home and read the books they've already got. I'm expecting more people shortly, though. Expecting more people.
Brian, the allure of a bookstore is the fact that you go in, you browse, there's serendipity, you find something you weren't looking for, but you suddenly have this urge to buy it. Can you have time to browse with the new rules?
Oh, there'll be lots of time. You know, I think it'll be a while before we go back to our former levels. of customer activity. So I think there'll be lots of space and lots of time for people to browse around. That may not be the case. I've been wondering if it might not be worthwhile to suggest to people that they, take 15 minutes in the store at most, and I'll help them if I can, but that so we don't have too many people in the store at the same time, and so people don't have to wait too long outside.
Yeah, because I've been in your bookstore, Brian, and you've got books everywhere. It's very narrow.
It is very narrow. So we've instituted a one-way passageway through the store so that people follow a bit of a circuit, and they can't go backwards. They have to just keep going in circles, I guess. So yeah, there are ways we can do that. And also I spent most of yesterday with a helper to get a lot of our overstock down into the basement to give people a little bit more room to move about our usually very crowded aisles.
So
of course, that's part of the charm, and I hope it doesn't lose that.
Yeah, this is a key moment for small businesses.
Yeah, everyone's making a sacrifice, and I fortunately was able to make use of the time during COVID to catch up on a lot of paperwork, administration, and so forth, and I'm sure a lot of my counterparts did as well. I know some of them actually have been taking advantage of the time to do works and improvements inside their stores, and that's a sign of confidence that they feel their business is going to weather the storm fairly well. In my case, despite the Gilets jaunes, despite the transportation strikes a few months ago, we had a pretty good surface. We've had a really good year and a half or so, and so we've been able to coast on that. Plus the 1,500 euros from the government doesn't hurt. So we'll be okay for a while. On a longer-term basis, you wonder how this is going to influence all of the expats and the tourists who often make up a large part of the business during not just the summer months, but any time basically from Easter until Halloween.
Jean-Louis Touraine, what's interesting is if you look at a map of France and where COVID-19 hit hardest, it's not the same map as the map of France of where businesses are the hardest hit. And where the businesses are the hardest hit are places like Paris, like the Riviera, like Corsica, places where there are lots of tourists. And those tourists are not coming back this summer.
Certainly not from the other countries. Hopefully some from France. We believe that many French people will wish to have some vacations, and they will have only the possibility to have vacations within France itself for various reasons. So it can compensate partly the lack of tourists coming from other countries. But it's true that the economical activities, the cultural activities also will be severely damaged, and they will have to be reconstructed, probably in a different way than it was precedently, but certainly it has many consequences. Hopefully, we can develop improved activities as a result of this crisis.
Yeah, because we're out of time, but just let me ask you this. You said earlier, this is so unprecedented, this pandemic. We don't know whether or not the government's going to have to pull on that emergency brake and put us all back under lockdown completely.
It is likely that there are, in small areas, need to develop isolations. Isolations of small cities, isolation of some people, isolation within the families. You know that contamination is the most frequent within the family itself. So individuals must be isolated from their family at least for a few weeks. So all this will develop along the next months until hopefully we'll have a vaccine. But we'll have to live with coronavirus for the next months, and we'll have to modify our activities, all our activities, health activities, economical activities, cultural activities, sports, and everything. We'll have to, and hopefully it can bring new thoughts, and we may take more concern of the environment, the ecosystem of humans in the nature and among other animals and so on. So all that will have to be taken care of in the near future.
All right, that need for a great reckoning we were talking about. Jean-Louis Touraine, I want to thank you so much for joining us from Lyon. I want to thank Laurent Slimani for being with us from Rouen. In Paris, Jakob Hessler, so many more questions. Unfortunately, we're out of time. By the way, you can join the conversation if you want to pursue it on Facebook and on Twitter, or subscribe to our YouTube channel. Bye for now.
France 24. Every art form.
Liberté, égalité, actualité.